Okay. Okay. Welcome to the workshop on headaches tonight. So liberation from headaches, of course, we're going through the series on all the different common problems, headaches, back pain, neck pain, any of the typical chiropractic issues that we deal with on a consistent basis so that we have a reference point to go back to in order to deal with these different things. So, of course, this is a topic that affects a lot of people for various reasons, and you're going to see as we go through it, typical, medical approach for things is to essentially overdiagnose, where what I mean by that is you're going to see as we go in that there are just huge numbers of diagnoses for headaches. But the problem is, even though we have this vast array of diagnosis codes for headaches, the vast majority of them fit into very small categories, right? They're typical things, and most of those issues pretty much never get addressed. So as we go through the information tonight, you're going to see that I'm going to categorize things different from what the medical counterparts are going to diagnose them. And of course, the treatment pattern is going to be completely different. It's going to be on a different wavelength altogether. So first thing, in terms of spinal anatomy, again, I start off each one of the liberation from workshops with this point that if you want to understand the full spinal anatomy and how all of this comes into play, I really encourage you to go back and watch the workshop, The Science of Spinal Correction. This is a doctor level program that we use to train doctors in corrective processes and how to fix the spine through chiropractic and how to analyze x-rays and everything else. So go back and watch this workshop. It's got a lot of just very, very valuable concepts in it. But of course it's built to where anybody can understand it. So go back and watch this workshop. It'll be good to you. Principal truths, again, this is exactly the same information as any of the other liberation from workshops. First thing, it must be remembered that you should never expect to be fully out of pain, fully functional, or truly healthy until the spinal curves are in their normal balanced mechanical state. So what that means is if you have, for example, scoliosis and you have back pain, okay? You come in and you start under care and we're working on it, and for the most part your back pain goes away, but then 3 months down the road, all of a sudden your back goes out again. Does that mean that chiropractic doesn't work? No. We could be reducing the scoliosis a good bit, but until that curve is completely out, until you are back to a normal state, the way that it looks in a textbook or in any medical dictionary, you're gonna see that the problem is bound to have flare-ups. The difference is you're just not going to have as many flare-ups. So in terms of headaches, it's the same thing. Until you get a normal curve back in your neck, for example, tension headaches are not going to go away permanently. You may still have headaches here and there. So the point is number one, to reduce the headaches. Number two is to fix the underlying cause so that the headaches don't continue to return. Okay? And even then, that doesn't mean that you're never going to have a headache again. I still get headaches, and I've been adjusted for 13 years. Now, trust me, they're very random and they don't happen very often. We're talking usually it's like dehydration or something like that. But still, just because you get adjusted is not a free ticket to never have healthcare problems again. I say this point all the time that chiropractic is ultimately a losing field. Okay, what I mean by that is all the patients still die, right? When it's all said and done, we're still in a state of deterioration. That's unavoidable. As long as 1 out of 1 patient still die, then we're in a losing battle. But the point there really being is that we want to extend the years and the quality time as much as possible. And we can't do that. But don't expect the golden ticket. This isn't Willy Wonka. If the spine has degenerated or been injured to a point where normal mechanical function can no longer be achieved, then expectations should be focused first on prevention of further damage and not unrealistic solutions, which goes back to the first point. The expectation is not at this point that, you've got phase 3 degeneration, but we're going to somehow magically reform the spine back to its original state when you were 20 years old, and you're going to go back to playing hockey again. You know, that's just not reality. So if you've gotten to number one, the first point you should see there is that when is the best time to start care?
Early as possible.
As early as possible, when it's still prevention care. So that's why we start adjusting kids right away and babies right away, is so that we don't ever develop the abnormal problems underneath, so that, you know, we can now grow and develop properly and accordingly, and we look like a textbook as we come up, not some distorted pattern that we then have to go back and fix. Make sense? Number two is, if you've got degeneration that's already there, we're not gonna undo all that damage that's there. We're just trying to stop the degeneration from advancing further, which you can do in a lot of cases. But removing bone spurs, I haven't seen that happen yet. That's not something that we've seen achieved yet. I don't know that, maybe we'll find some, I don't know, maybe there's some essential oil out there I'm missing that can do that. It seems to, some people think that can fix everything. So maybe there's something there, but we don't know of it yet. The third one, elimination of symptoms is never my goal, but rather correction or stabilization of cause. Now, that's not some brash statement that's saying, I don't care how you feel, I don't care what your symptoms are, that's not any of my business. We're not saying that. What we're saying is that the goal is not to eliminate symptoms. If we eliminate symptoms, we're just as happy as you are. But the goal is to get the spine back to a natural, normal, functional state. Does that make sense? Okay, so we've got to always distinguish the difference between those, because it's so easy when we're trained to think symptoms, symptoms, symptoms all the time, to just default back to that and just think, well, what are we going to do to get rid of my symptoms? And what happens in that mindset is, as soon as the symptoms are gone, what happens? The attention is no longer on the problem. And now it's like, okay, well, I guess I'm good. Doc fixed me. And so the problem stays there, and let's say it continues to get worse and worse, then you're back 5 years later with the same issue and worse. And now it can't be recovered because now we're into a state of degeneration. Make sense? Okay. So those are things we've got to remember. Now, the next thing I want to go through is just understanding, again, always correlating back to the complexity of anatomy and physiology and biomechanics. Okay? This stuff is so incredibly complex that there is just simply no way that our brains, our brains can figure out what exactly is going on during normal movements. We went through that in, I think it was the liberation from back pain. We went through a video of a robot walking, that can walk on an uneven surface now, and it looked like a drunk guy. Pointing out that the best technology out there, processors that are calculating and recalculating as fast as they can, they still can't keep up with all this stuff and build a robot that's actually stable. It's just kind of stumbling all over the place. Okay? So looking at this is going to show you, because we're talking about headaches now, not just muscular issues. You're going to see the blood vessels come up on here. You're going to see the nerves come up on here. I think you are. There we go. Okay, so the blood vessels, you've got the veins. Now you've got the nerves that are added on top of that control everything. Now we're laying on the ligaments. Okay, now we get into the muscle layers. And watch how many muscle layers that there are that create this complex system of movement that you so fluidly use without any thought or action at all. I mean, we just use this stuff every day. You don't think about what's actually happening. But you deconstruct this and think about what's happening. It's absolutely mind-boggling. So the fact that we can figure anything out, that we can get any results, in itself is a miracle. That points back to one thing. The miracle I want you to understand is the miracle of how your body is built. That this thing is so incredibly organized and so meticulously complex in that organization. It's a miracle that you function, right? It's a miracle that any of us are able to do the things that we are. And it just goes back to that innate power, that potential that you have inside you. Obviously, God knew what he was doing when he designed the body, right? Or if you want to believe it's some other force, it doesn't matter. Mother Nature, whatever it is, it works, right? That we can't argue. The source, some can argue, but you can't argue how amazing it is. Understand? Okay. So, the types of headaches. Headaches can result from a wide range of causes, both benign and more serious. Brain tissue itself is not sensitive to pain as it lacks pain receptors. Rather, the pain is caused by disturbances of the pain-sensitive structures around the brain. 9 areas of the head and neck have these pain-sensitive structures, which are the cranium, the periosteum of the skull, the muscles, nerves, arteries, veins, subcutaneous tissues, eyes, ears, sinuses, and mucous membranes. So that's all for Wikipedia. So because of that complexity, okay, like I was talking about with medicine, we like to deconstruct things into every possible measure we can. That if one little detail is different, well then it deserves an entire different diagnosis, even though it might be the same thing. So blue isn't blue. Blue is 1,000 different shades of blue, right? That's the way we tend to think of medicine. So as a result, there are more than 200 types of headaches, 90% of which are considered primary headaches. The most common are migraines and tension type headaches. Keep that in mind. Of course, we will only cover the common types for sake of time and the majority of patients. We don't have time to go through 200 different types of headaches. Most of them, like I said, fit into other categories anyways. But primary headaches means that it's caused primarily, it's more of a direct function. It's not an indirect function. A secondary headache would be caused by some other organ problem, some other disease that's just secondarily causing the headache. Make sense? Okay. So first type of headache, this is one particular we can't fix, right? So there's some types of headaches you just can't do anything about, and an impalement headache is definitely one of those. So that's not a chiropractic problem, so we're going to skip over that one. The first one we are going to cover is a migraine diagnosis. The differential diagnosis is pulsing head pain. Who in here has had a migraine before? Okay. If you guys are lucky enough not to have had a migraine before, you are lucky. Okay, they're terrible. I mean, like I said, I have headaches once in a while, and they are migraines when I get them. And I mean, it's just you're curled up on the bed, can't see. I mean, lights out, sound out. Sound of the kids is just like they have to be on the other side of the room or on the other side of the house altogether. I mean, you can't stand any sound whatsoever. Just literally rolling around, writhing in pain. I mean, it's hit that time. I don't know if anybody else that has had migraines before, where the pain is so intense that at some points it actually makes you laugh because you're like, I can't believe how bad this hurts. It's kind of like you after you broke your leg, right?
That's a little different than a migraine.
Still hurts.
Yeah.
I'm just thinking back to that picture where she just busted her leg in 4 places, and she's got her head rolled back in like a straight up belly laugh. Like, it's hilarious. Okay, so pulsing head pain feels like a heartbeat. Okay, you can literally feel the heartbeat pounding inside of your head. Nausea, vomiting, it can actually cause you to vomit. Photophobia, which means sensitivity to light. Phonophobia, which is sensitivity to sound. It can be preceded by anybody that knows what that aura is, would understand it. We're not talking about purple hippie lights, that kind of thing. This is different. But it's flashes of light, blind spots, or tingling in the arm or leg. And a lot of times people have a very consistent aura before they get hit with a migraine. Migraines, of course, can last from a period of 20 minutes to days. It just depends on the person, but usually it's preceded by some kind of like ramp up period, and then you have the migraine, and then once it goes down, that's like the post migraine period where you just feel flat out exhausted, and now you're in recovery. So the causes, they say the changes in the brainstem and its interactions with the trigeminal nerve, which is a cranial nerve. Imbalance in brain chemicals, including serotonin. Serotonin levels drop during migraine attacks, which may cause a release in neuropeptides traveling to the meninges of the brain, causing pain. So the meninges is basically the covering, the sheath around your brain. And so that, of course, does have nociceptors, the pain receptors in there, and that's where the pain comes from. But this is the best that they can understand as of right now, although if you do some research on this, you'll find they really don't know. I mean, this is like the best information that we have. We can see and measure the serotonin drops. You can see the activity in the brain, but they still don't really understand exactly what causes it, right? So that's a big function. There are triggers, okay? There's hormonal changes in women, foods, especially with preservatives, food additives such as aspartame, drinks such as alcohol, wine, or soda, stress, sensory stimuli, sleep patterns, physical exertion, changes in the environment, and medications such as oral contraceptives and vasodilators. So if you were to look at that list of things that are triggers, what is the common function? What organ system in your body does it directly affect? Think chiropractically for a second, right? Exactly, your brain and your nerve system, right? It directly, all of these things are nervous stimulants, right? And so that's a big function when you're trying to deconstruct this. So the whatnots, painkillers, they're merely symptom killers. Aspirin, Tylenol, NSAIDs, those are non-steroidal anti-inflammatory drugs. They're used regularly. When they are used regularly, they lead to ulcers, stomach ulcers, gastrointestinal bleeding, kidney, liver damage. We know that every single time you take a medication, they do cause damage to your system. So in the case where you're in the middle of a headache, the question, of course, anybody that has had a migraine will ask is, do you care? When you're having a headache, you don't care. You just want to get out of it. Now, honestly, I will say, I'm sorry, I still don't revert to the drugs. Like, if I have a migraine, I will lay there for 2 days straight. I won't take the drug. It's just because I know the damage that's done and I know how they would affect me. So I'll do the natural stuff. I'll use white willow bark, and stuff like that. But I'm not going to revert to the drugs. Now, if I get hit by a car and my leg is hanging off, and I'll probably take some morphine or something like that. But it's going to take, my rule with taking medications is I'm going to be like bleeding and unconscious. Those are two prerequisites to taking medications. And even then, it kind of scares me. I just don't like medications. But I understand, right? I understand that when you're having one, that's just not really necessarily a consideration then. But you have to understand that if you're having headaches all the time, right, like you used to, you take these medications on a regular basis, then that is going to add up and it's going to catch up to you. So it's not trying to retaliate every time that you have a headache. You've got to pre-frame and be working on the cause instead, right? Not going after the symptoms, going after the cause. So the next category, triptan drugs, cause constriction of blood vessels, which of course leads to dizziness, drowsiness, because you're not getting enough oxygen to your brain and nerve system. They have warnings for stroke, of course, because if you constrict blood vessels and you don't have enough passage as it is, now you stroke out as a result, and heart attack, of course. So obviously that's not a very safe category yet. Those are the drugs, Imitrex, and all the common drugs that you see people take all the time. This is what they do. They constrict blood flow. Ergot caffeine combination drugs are less effective and may worsen nausea and vomiting. Therefore, of course, we give you anti-nausea drugs, right, to deal with that. So you take anti-nausea drugs, which are often included, like I said, to null other side effects. Then opioid drugs. Now you see the commercials. Wasn't there a commercial during the Super Bowl?
Opiate.
Yeah.
And do the constipation.
Yeah, opiate-induced OID.
Yeah.
That's a new thing. Yeah, so if you have OID from taking opioid drugs to get your bowels moving again, that's different. So talk to your doctor because we now apparently have a drug for that, right? Not a solution, not get off the opioid drugs. We'll just give you another pill on top of that. So like it says here, the reason why they go that route is because they know a lot of these people won't get off the opiate drugs because they are habit forming, they're narcotics, okay? Glucocorticoids cause steroid toxicity and skin thinning. If we see patients that come in and their skin just looks like paper mache, if you've ever seen somebody like this, they have the purple blotches on their arms. You see it a lot in elderly people, they have blotchy arms, and they'll like walk along and they'll just catch their arm like this and it just gashes wide open. The skin just rips and peels back and they're bleeding all over the place. And then, of course they fold it down and now they've got this big old purple blotch underneath their arm for the next 2 months. So these drugs are no better. For prevention doctors, they prescribe beta blockers, antidepressants, because apparently if you're having migraines, you're just depressed, right? So we're going to give you antidepressant medications. Maybe that will make you less depressed about having the migraines. Anti-seizure drugs, and even Botox injections. There's even a couple years back, I remember seeing a study where this is mind-blowing. They would do Botox. I imagine they're still doing it in some cases, but they would do Botox injections into the suboccipital muscles, which implies something very interesting, that they know the problem is in the suboccipital muscles, right? So they would do Botox injections into the suboccipital muscles when the patient's having a headache to see if it relieves a headache. And if it does, then they surgically cut the suboccipital muscle. We call it bobblehead surgery, right? They just cut the muscle. So even though we know the problem is there, that's their solution, to just cut it. Then the muscle can't contract. It sounds like a perfect solution, doesn't it? So,
Anyway.
unreal. Okay, so as far as home care goes, you can try to avoid triggers if you know them. That's easy if you know what your triggers are. If some people they know if they're around, for example, perfume or cologne, then they're going to get a migraine, so they just try to stay away from it. That's kind of hard when you're in public because some people wear too much perfume, right? Exercise seems to help reduce occurrence, and getting estrogen balanced can help, but that's not always easy either, right? How many women have estrogen imbalance issues? Men? How many women have estrogen imbalance issues, right? Too many. But the big picture is the body's ability to properly accommodate to these factors, right? It doesn't take a lot of headroom to look at this and say, okay, we know all of these triggers are neurological. Okay, it's all activating the nervous system. And the advice out there, the going advice is to avoid the triggers. But it's not the triggers that are the problem, because I may have a problem with them, but you don't. And the next 100 people in the line don't. So what is the problem? Is the problem the trigger? No, the problem is not the external factor. It's how my internal environment is regulating to that trigger. That means we need to work on the body's ability to regulate and accommodate for those external factors. Do you see why medicine has a hard time with headaches? Because it's not about inside out. Everything is outside in, so you can see why it's all treated outside in. But we need to look at it from an inside out approach on how we actually accommodate to these factors. Okay? So the treatments, this is amazing. The Mayo Clinic website doesn't even list chiropractic as an alternative treatment for migraine headaches. If you get on there and you look at their alternative treatment section, and they mirror every other website out there, it just doesn't even mention chiropractic. Okay. Now, how many people have just in here? How many of you have had a headache, even a minor headache, before? Come into the chiropractor, gotten adjusted here or somewhere else, gotten adjusted, and the headache has gone away before you walked out the door. That was just about every hand in here, right? So anybody that's experienced that is like, looks at this and really, it's not even an alternative. Yet you list acupuncture and you list, these other things. I mean, what is that, right? It's just denial. That's what that is. It's not giving any credit, not even listing it, so that people don't even consider the word chiropractic. I mean, you can't bash it anymore, right? Because it's too mainstream now. So the best option now is to just try and ignore it and hope it doesn't continue to gain traction. We're going to make sure it gains traction, right? I mean, that's just what has to be done. So the common factors here are cardiovascular synergy, brainstem function, and neurological homeostasis. So let's break that down. Okay, number one, cardiovascular synergy. It's how your body, we know that a lot of migraines have that vascular component. That's why you feel that pounding inside of your head. You feel the heartbeat. A lot of times it is the meninges, which is vascular. So the problem is the cardiovascular synergy. It's how your body is regulating the blood system across your entire body, right? It's the same thing. Why does somebody get dizzy when they stand up too quick, right? Because that's the nerve system is not in that split second regulating the constriction and vasodilation of the blood vessels throughout the entire body. So well, you might know this, you might not know this, that if common wisdom is if you released all the capillaries throughout your entire body all at the same time, Kelly, what would happen?
Shut down.
Yeah, you'd hit the ground. You would actually die because your brain would lose oxygen supply just like that. So when you look at that factor and how your brain keeps every capillary throughout your entire body, a lot of these capillaries only big enough to pass one red blood cell through at a time. And the fact that your brain and nerve system coordinates that and keeps it all working at the perfect dilation all the time, who are we to guess what normal blood pressure is and what isn't? But the problem is still that the body is not registering and it's not accommodating properly how to keep that synergy and balance when these attacks happen. Make sense? So what do we want to do? We want to affect how your body creates synergy in the cardiovascular system. How do you do that? You can't do it by directly affecting the bloodstream. We know that because we look at all the people on blood pressure medications. How does that work, right? So the only way we do that is by clearing the nerve system and let the nerve system determine what normal is, right? That's always the answer. That's always the same answer. Second one, brainstem function. Okay, we know that this has a major component to it. Why? Because the trigeminal nerve is one of the cranial nerves that exit through the occiput and wrap around to the face, right? Controlling many different functions. So if your brainstem is being compressed by atlas misalignment, C2 misalignment, and your brainstem is under undue stress, then that's going to affect down the multiple steps down the chain neurologically, right? So that's an issue. Then neurological homeostasis is really just a branch off of that. It's how your body is regulating everything as a whole. Is your body operating in a state of neurological homeostasis where the nerve system is effectively taking care of itself and the rest of the organism as a whole, right? So these are the big factors that are the common components, yet this stuff isn't being really talked about. Well, what drug therapies can we give you that work best? Is it Imitrex or is it Toprol or is it, aspirin or Topamax or is it, Excedrin migraine? Which one seems to work the best? Those are the only options. Why? Because only a drug can cure, I guess, right? That's what the FDA says at least. So is it any surprise given these factors that often migraines are shut down quickly or even immediately following an upper cervical adjustment? Why? I mean, when you look at these factors, it's very simple to see why somebody will come in here literally with a coat over their head, sunglasses on their face, just walking in the door like this, and they lay down on the table and pow. I mean, you feel their atlas move, just release like a gunshot, and they immediately, boom, they just come back to. Glasses off, coat off their head, and especially for the non-believers, right? The ones who don't necessarily get chiropractic yet, do they get it now? Just like that. I mean, it's just like that, their life's changed. They'll never doubt it again, right? Sometimes we as chiropractors like those moments because they're great teaching moments, right? So it's not a surprise when you understand the anatomy, the physiology, the neurology behind it. It's not hard to explain. Okay. Now, why isn't this explained more in the research then? It's simple. Who funds research?
Not chiropractic.
Not chiropractic, right? Drug companies. They fund research. Money funds research. If you look at the pool of money being poured into chiropractic, I mean, you can't even say that. There is no money being poured into chiropractic. It's all being poured into medicine. Insurance companies deliberately limit what is going into chiropractic to keep a foot on top of it. They're trying their best to strangle it out. Okay, the next one, tension headaches. The differential diagnosis. It feels like a tight band around your head. It's dull and achy. Sensation of tightness or pressure across the forehead, the sides, or the back of the head. Okay? Tenderness on the scalp, the neck, or the shoulder muscles. Okay, the causes. This is the most common type of headache in which the medical system says causes aren't well understood. Again, according to the Mayo website. Okay, they say that it's not well understood. Ironically, I will just say here, since I've picked on the Mayo Clinic a couple times, if you have not, go back and watch the workshop on chiropractic history. It's really interesting that Dr. Mayo, Dr. Charles Mayo, the one that started the Mayo Clinic, he actually brought his wife, who he couldn't get well, to Dr. B.J. Palmer, the creator of chiropractic, or the developer of chiropractic. He brought his wife to Dr. Palmer, and Palmer got her well. And until the day he died, they continuously got fed a stream of unknown referrals from the Mayo Clinic. And then when the doc died, Dr. Mayo died, that kind of dried up, and they went in the direction that they are today, or continued in the direction that they are today. So the causes aren't well understood. Their theories include heightened sensitivity to pain or stress, which affects what? The nerve system, right? The nerve system. Okay. Increased muscle tenderness, which is controlled by the nerve system. Of course, research only finds what it looks for. That's the whole point, is that when you do research, you only get what you look for. So if you're doing a research to find out what effect Tylenol has on whatever, that's what you're looking at. You're not going to find some other finding. In fact, you can go so far as to say that research is directed to the finding they desire in a lot of cases. Understand? Meaning that they set up a study with the results in mind when they start the study. They're just looking to produce it. And in fact, for a drug to get passed and approved, they only have to get, I think, 2 positive trials. It doesn't matter if there's 50 negative trials leading up to that. They only have to have 2, even if they can't be reproduced. There's a lot of studies that they go back and they review and they try to reproduce independently later. They can't do it. They don't get the same results. They get a completely different negative set of results. But that's how the process works. So this never-ending esteem that we give to research as being the gold standard of healthcare is a myth. Because how much common sense do we throw out because we're looking for research to prove anything that we choose to believe? Right? It's a joke. We've got to realize it's a myth. I'm not saying all research is bad. There is good research out there, but it's like the internet, right? There's good stuff, but there's a whole lot of bad stuff too. So you have to know what makes sense and make common sense out of it in the meantime, or else you don't know what you're looking at, right? So the big issue here is, of course, tension caused by the nervous system. And when you understand the symptoms, you get where that comes from. For example, let's just take one, tenderness on the scalp, neck, or shoulder muscles. Why would that be? How about because the muscles that come from the back of the neck, they come up to the top of the head and they cut off right here, right? You have muscles that cut off right across the top of the head from there. So you feel pain on the top of your head because that's where it's pulling. That's where the tension is, okay? The neck and shoulder muscles, I don't think I really have to explain that one any further than it is. But these are just the common findings. The stress is often reported as the most common trigger. Go figure, right? This in itself could relate to multiple different factors from somatovisceral, meaning that the nervous system is causing a response in the tissues, right? So you're under emotional stress, for example, and because that causes you to walk around like this, now you start having chronic tension headaches because of the forward head posture, sure, right? So the original problem was neurological, it was emotional, but it's now translated into a very visceral response. It could be overstimuli or overuse. So, for example, you have your head down, doing this all the time, right? Playing on your cell phone, Candy Crush, all that stuff. So when you're like this all the time, obviously the weight of your head is much more, okay? Because when you're upright, it's like I explain this all the time to new patients. You take a bowling ball, you hold it on your shoulder, right? You guys probably remember me talking about this. You hold it on your shoulder, and you can hold it here for a long time, right? You can hold it over your head. You can hold it there for a long time. But you take that same exact bowling ball, and you hold it out like this, that thing's going to the floor in less than 30 seconds, most likely, right? Because it's so much more leverage on your shoulder because it's out of the center of gravity. So your head going from here to here is a big deal, right? So that creates an overstimuli, overuse response. It can also be homeostatic insufficiency, meaning, let's say that because of an accident, okay, you have a damaged nerve in your neck that controls the muscles, okay? Now the nerve system isn't able to keep a homeostatic environment in the neck. The muscles aren't working anymore, right? The nervous system can't make the muscles work harder. They're not connected, okay? So as a result, your head hangs and it's too much for the muscles that are working, and it creates a system of headaches. Now, that's in the case of an injury, but it doesn't need to be that much. It can be subluxation. It can be a bone, out of position that's now creating a scenario where the nerves aren't getting full supply to the muscles. We see it all the time, right? So medical doctors will often prescribe from the same list of drugs as with migraines because they don't understand tension headaches and they don't understand what causes it apparently. They just feed them headache medications, which migraines are the top sellers, so that's what they pick from. And here, let's try this cocktail, and let's try this one, and then try this one, and then try this one, and we'll find one eventually that doesn't work, and if that doesn't work, then we'll give you antidepressants. Fair enough, right? So in other cases, they will link headaches to a number of other possible causes and recommend surgery to your eyes, maybe your jaw. You'll see people that, we think your jaw is out of alignment, so we're going to break your jaw and saw a piece out of it and then, staple it back together and everything else. So we do all this surgery to fix other problems, but the issue is this, whether it reduces the headaches or not, there is no going back. So you're stuck with the result. So if it doesn't fix the headaches, oops. I mean, that's the best answer you get, oops. I mean, what are you going to do now? You elected to go into the surgery. So there's no, well, Doc, can you put it back where it was? I kind of liked it that way. I mean, it doesn't work that way. So that's why surgery should be the absolute last option. Okay? Home care, rest, relaxation, making sense so far, right? You're taking the stress off the nerve system. Hydration, a lot of times these can be relieved by just overhydrating to a degree. A large variety of supplements. I'm not going to go through a list of supplements. Why? Because they kill symptoms, right? Symptoms are, a supplement is still outside in most cases, unless it's filling a nutritional deficiency that's going to affect a lot of different areas. And trust me, you can go back and watch the deficiency workshops. We're all about filling deficiencies. But I'm talking here like, using white willow bark and using, different essential oils and stuff like that. Yes, they may work, but they're still symptomatic. They're still outside in. So, if you find one that works, that's fine. But we want to fix the cause, not just give you a palliative to get you through recurring headaches while they get worse and worse and worse. Make sense? Okay, so reduce stress, improve lifestyle habits, etc., etc. Okay, treatments. The real question is, how do you improve the nerve system's ability to adapt to environmental and internal variables? It's exactly the same as migraines. Okay, it's how do you change. For example, somebody that sits in front of a computer, they work all day long and on a laptop like this, or Facebook, right? For 6 hours a day, or 8 hours a day, they're like this all the time. How do you fix that? You're not going to fix their tension headaches until you fix that, because that's when they're having the headaches. They sit there all day and then they can't figure out why they're having headaches at the end of the day, right? So until you change the environment, get them into an upright seat, get the monitor up, bring it closer so they're not leaning forward so that they can sit upright, you're not going to fix a problem. You've got to get them to that place. So fix the external environments, fix the habits. And that includes the internal variables also. Until you fix the rotation and translation of their atlas and everything else, then they're probably still going to have mechanical dysfunction. Okay? Goes back to what we said at the beginning. So the answer to this question explains why the majority of chiropractic patients we see for headaches experience a decrease or a complete elimination of chronic headaches. Okay? And again, if you've ever had, raise your hand if you've ever had a headache, go away. Just so everybody on the camera can see, okay? It's not just me talking. Talk to anybody that's seen a chiropractor for headaches, and they'll say the same thing. Some people will still call chiropractic voodoo science and all that kind of stuff. I mean, if we're talking voodoo here, then I don't know what real voodoo is, right? Because all we've talked about is physiology and anatomy and understandable situations. I mean, this is all scientific principles. There's nothing really, I would have no problem sitting down and discussing this stuff with any medical doctor. In fact, most neurologists that deal with this stuff all the time, they would never disagree with this. They'd just be like, yeah, that makes sense, let's try it. We know because we get it all the time. We have patients go in, I even refer them to neurologists, and they'll come back here and the neurologist is like, yeah, they were right on the money. So, it's, point being, anybody that's watching the video, or you got a friend or a family member that has headaches, that is skeptical that it's going to work, just tell them, just try it. If it doesn't work, what's the worst case scenario? What's the worst case scenario? Nothing. You did less damage to yourself than taking one single Tylenol. So, it's worth the effort. It's worth trying. The next one, cluster headaches. We're going to go through these ones a little bit quicker because they're just not as common, okay? We hit the two big categories. The differential diagnosis is more common in men. These are one of the most painful types of headaches, often awaking in the very middle of the night during deep sleep with intense pain in or around one eye or the side of the head. It can cause excessive tearing. Your eye just pours. You have a history? Okay.
Daily, almost daily.
Eye just pours, redness of the eye, stuffy or runny nasal passages, sweat, pale skin, swelling, drooping eyelid. Anybody that's been through neurology classes, you look at this list and you're like, oh my gosh, that is a neurological response, right? This is an overactive nerve system. It's causing every single thing that is controlled by the trigeminal nerve to go crazy. Okay, so of course, what do you find as far as cause? Cause is unknown, but the hypothalamus in the brain is implicated due to regularity with time and season, suggesting that it's somehow following biological clock coordination. Okay, these tend to come in cycles, and when they come, people that have them are very cyclical, and they'll have them for a period of time, and then it just stops, and they can't figure out why. And then sometimes patients will have them the next year at the same season, and it'll go, and then it'll stop. They tend to be very, very cyclical, so they know that it's most likely the hypothalamus, which we know is very much impressed through chiropractic care. Okay? So it is known that they occur when the trigeminal autonomic reflex pathway in the brainstem is activated. We know this stuff in the research now. So go backwards now. The triggers, generally unassociated. There's not really any major triggers in most cluster headaches. But during a cluster, consumption of alcohol can quickly trigger a splitting headache. So most people won't touch alcohol when they're having cluster headaches. Okay, the whatnots. The medical doctors will prescribe again triptan drugs by injection. So they hit you harder and faster. Nasal spray or tablets. Sandostatin is an injectable synthetic version of the brain hormone somatostatin. Lidocaine injections are also used. Preventative drugs are prescribed such as calcium channel blockers, corticosteroids, lithium carbonate, nerve blocks, ergots, etc. The problem is they all have side effects and none affect the cause because they don't know what the cause is. They know the pathway that it's affecting, but they don't know what the cause is. So they just, treat what? The symptoms. It's what they always treat, the symptoms. In some chronic cases, they'll recommend intentional destruction of the trigeminal nerve. They'll actually go in and blast the trigeminal nerve and just fry it, so that it no longer works. Hey, problem solved, right? You no longer have all the symptoms in your face because the nerve itself is dead. Unfortunately, you have none of those features anymore, right? You can't do any of those things now because the nerve is busted. This is highly disputed even in medical circles. You know it's crazy when even in medical circles we'll dispute it, right? Okay, so home. They list kudzu extract may decrease pain. Okay, when you look on the websites, kudzu extract, we have no shortage of that, so just go on, chew on some, on the side of the road anywhere around here, you're going to get plenty of that. As well as melatonin may help with night attacks. I bet you can guess what they don't recommend, what they don't talk about as an option. Chiropractic, it's not listed. Okay, they do say, and this, I can't say anything wrong about this. Oxygen therapy does help for many. That's okay. You're not going to hurt yourself sucking a little bit of oxygen. That's fine. And if it helps in the midst of one, totally okay with that. But again, you're kind of waiting for the headache to happen to do that as a response. You're not just sucking oxygen all the time, right? So this is, again, a response therapy. Considering the hypothalamus is indicated, balance of this structure should be optimized. Reducing aberrant input, meaning distorted input into the hypothalamus via all of its connections. If you look at how that works, your hypothalamus is basically like a router or a network hub. It's got all the information from all over your body that just pours into it, and then it coordinates and creates its functions based on that information. So maybe, just maybe, it's getting all kinds of aberrant backflow information and now it's not able to process. Or it could be downstream and the hypothalamus itself isn't able to produce a correct response because of nerve compression and interference. So you change the aberrant input via all its connections, and supplementation to support may help. So, fix omega fatty acids, fix nutritional deficiencies, fix things that support the nervous system, get off of medications, that may be interrupting, all that kind of stuff. The good news is there is little chance of side effect from chiropractic care as opposed to drugs, like we were talking about. So, like other headaches, the only way to see if it works is to test it. I mean, I've had cluster migraine patients, cluster headache patients, that have come in the middle of a cluster headache. And I've adjusted them, and it's had little effect on that one time. I will not tell you that every cluster headache is gone just like that. In fact, if you get online and you look there at stuff regarding chiropractic and cluster headaches, you'll see that there isn't a lot of, most people, something like, 60% plus will say that they've tried chiropractic and it didn't seem to eliminate the headaches when they were having them. But you see, the problem is not about when you're having them. It's fixing the lead up to it, creating an environment in which the brain can create a state of homeostasis neurologically to where you don't continue to repeat the cycle. Make sense? Okay, so this is a tough one. Vascular headaches. This is the differential diagnosis. This category I would include, you'll look and you'll see all of these different things. Yep, I'm over 20 minutes.
Probably a stand.
So your watch is telling you it's time to stand? Nice. You can certainly do that if you need to. This category would include cough headaches. These are different diagnoses when you look, at the different 200 categories. Cough headaches, which of course is you cough, what happens? It increases what we call interthecal pressure. So your blood pressure instantly rises. And some people get a headache, right? Because they cough. And that pressure creates a back pressure in their head. Now, why aren't you regulating pressure correctly when you cough, right? That's the question. Another one, exertional. Why is it when I exercise and my blood pressure goes up that happens? The last one, or another one, it's not the last one, there's lots in here, sex headaches. Some people just get headaches when they have sex. Well, why is that? It's kind of the same on exertional, right? It's all the same stuff, but they're breaking it down into all these different things. I mean, I'm sure if you try hard enough, you could see, mall walking headaches, right? I mean, you could break it down even, why stop at exertional? Let's break it up into every possible thing that you could do to exert yourself and cause a headache. I mean, why stop, right? So, but they all go back to the same thing, is that they're vascular connected. All connecting points on these are linked to the vascular system balance. Increases in pressure cause imbalance of blood flow to the head, causing pain. Or it can also be decreases in pressure, okay? But neurological regulation of vascular constriction and relaxation is the big issue here. Does that make sense? Okay. All right. So neurological regulation of vascular constriction, how your veins and blood vessels are collapsing and releasing, that's really the issue here. Why isn't your brain coordinating everything across the entire system on a millisecond function? Why is it not doing that appropriately? That's really the question. Okay, and you can just see here, these are, just all the major branches of the blood vessel in the brain. It's, and you can understand why this is such a complex issue. Okay, it's caused through some form of exertion that triggers or a change in position where the brain experiences either a drop or an increase in pressure. The whatnots. Obviously, any drug that affects blood pressure should be considered here. I mean, if you're taking blood pressure medication, this has got to be a starting point, because you're throwing in a drug that is changing the very regulation of the nervous system and how it operates this system, this process, right? So you have to look at that. They don't allow the body to regulate blood pressure accurately. How can it? It's got a drug putting a wet towel on it, right? So any other problem with the vascular system as a whole should be considered as well, from surgeries or any other outside influence that can affect this. Medications, drugs, alcohol, all this stuff, can be a factor. Home care, regular exercise, and supplements to improve overall nutrition and target cardiovascular health on an individual basis. Okay, you have to, and this always has to be on an individual basis because every patient is different. But the most common issue is likely dehydration. The most common one by far is just people not drinking enough water and getting dehydrated, or drinking too much. You can even go that route, or not drinking any water and just drinking Coke all day. Right? You're drinking diuretics. So make sure you drink enough water if you experience these headaches, and see if that will knock it down. A lot of times when people come in with headaches, there's two things that we do. One, obviously, adjust, right? You adjust them. But the second thing that we do is we give them water. We immediately, give them a big glass of water and say, knock this down. I want this gone by the time you're done on the biplate, right? Because the idea is flush the body full of water. If you need to urinate it out, you will. But if it's a dehydration headache, it'll knock it out just like that. Even if it's not, you're still going to feel better, right? So chiropractic adjustments do affect cardiovascular balance as indicated in the research. Improvements in neurological coordination of organs obviously is a factor here. So improved brain to body connection is a win. Okay? We do have research showing that there is positive effects on blood pressure. The University of Chicago Hypertension Center, they did a study where they showed chiropractic was more effective than not one but two blood pressure medications at reducing blood pressure. We'll actually take people and check their blood pressure when they feel that it's high. We'll get a reading on it, then adjust them, and then send them back and get it taken again and see that it's 20 or 30 points lower. I mean, just like that, within 10 minutes, you'll see a drop like that. It doesn't happen in every case, but in a lot of cases, it does. I'd say in the majority of cases, it does. So, differential diagnosis for concussion, almost always linked to a known impact. So we almost always know, this one is not so hard because it's, I totally crushed my head on a sign while skateboarding, or something like that. I mean, you're gonna see a definite sign in place. Headache, problem concentrating, memory loss, imbalance and incoordination. Most people deny they have a concussion because symptoms are low enough to question. Like, they try to stay on the field because they want to continue to play. So they'll deny that they have a concussion. The brain has taken a blow, so throwing in drugs creates just another hurdle to the healing process. Now your body has to deal with the medications on top of the concussion when the brain is already impeded by the blow there. The best bet is to take time and simply let it rest. Your brain has to heal. Okay, that's a big factor here. It just has to heal. And of course, we know in the research now, it doesn't always heal. Watch a new movie by Will Smith coming out, and you'll see that's the case. The NFL wouldn't be in all the trouble that they are if it healed every time. Okay, the next one, stroke, aneurysm, and hemorrhage, we can kind of lump these together. The differential diagnosis could be sharp stabbing, but could also have gradual onset. They're not always quick, okay? The key to diagnosis here is neurological impairment, such as loss of memory, slurred speech, etc. Now, unfortunately, some of these patients, once in a while, do end up at a chiropractor's office. Why do you think that might happen? Because they have a headache. If they've used a chiropractor before and it's gotten rid of a headache, they might go to their chiropractor thinking, I'm going to get adjusted and this is going to get rid of it. You guys might have seen, there was a we'll say a model that was actually just died here last week or something like that at 34 years old after apparently visiting the chiropractor. And she had, if you look at it, I don't know the full details of it, but she had a headache and went to the chiropractor and got adjusted one day, and then went, still had a headache and went back the next day, and there was text messages of the family like, hey, I'm going back to the chiropractor, and stuff like that. And I think it was like the day after the adjustment that she died of stroke, and so you look at that, and what the research shows is that you have about a 1 in 2.5 million chance of dying after a chiropractic adjustment from a stroke. Okay? And when you look at those numbers, what that means, you have just as much chance of dying going to your medical doctor or walking the dog or driving your car or anything else. The reality is this, and this is the way it usually ends up in court, if it does go that route, is because of this information, it's, you look at the details there and it's like you have to prove that it was actually caused by the adjustment. Now in this case, how can you prove that the adjustment of all things that she did, and she had done multiple times in preceding days, that the adjustment was the thing that did it when she didn't die until the following day after the adjustment? Yeah, why is that being planted as that's the cause? You see what I'm saying? So most likely what usually happens in these cases is, like I said, they're having the symptoms of a pending stroke or an ongoing stroke. They have a slow, gradual bleed, not a hemorrhage, and they mistakenly go to the chiropractor instead of the ER, because how do you know the difference, right? And in some of these cases, the chiropractor does miss the signs, does miss the fact that they're slurring in their speech, or they have foggy thinking, or it doesn't ask enough questions, right? So that's really the issue at hand. So the whatnot here is don't sit around and wait for it to get better. That's the key. If you're noticing neurological symptoms of impairment in thinking or slurring or anything like that, that goes with a headache, you pay attention to that. And you know the signs and you send them off. A good doctor will do that. But you as a patient have to also know, something's weird when my spouse can't put a sentence together, right? You have to identify that and know this isn't just a chiropractic problem. Okay? So in that case, if you experience these symptoms, the chiropractor is the wrong place to go. You should head straight to the emergency room, plain and simple. Okay? Because in some of these cases, it may be too late if you wait, around for a couple more hours. Meningitis, encephalitis, or infection. The differential diagnosis: severe headache with flu-like symptoms, sudden high fever, stiff neck, nausea and vomiting, confusion, seizures, difficulty walking, sensitivity, no appetite or thirst, and skin rash. Okay? You can see these are not migraine symptoms. Some of them are migraine symptoms. But this is a very different setup. There's a point in time where, we have had a case where a patient developed bacterial meningitis. We were talking about it before the workshop. And, and she came in for 2 days before with just a generalized headache. And her neck was a little bit painful, right? But that's a typical ordinary case. There was no signs of any of this other stuff. She got adjusted, she went home. The next day, had it again, got adjusted, went home. That night, the mom saw her fever going up. This was new, right? And so, of course, she did the right thing and she brought her to the emergency room, and then she was diagnosed with bacterial meningitis, and the doctors couldn't believe that she had been dealing with that. She had this infection for 3 or 4 days now, and that she actually survived it. She pulled out of it fine. But you see, there was a difference between these generalized symptoms and then it started presenting a new set of features. Any good doctor is going to pick up on that and say, oh, you've got a raging fever and you can't look down, and without having blistering pressure inside of your head, you need to go now. Like, this is not a migraine, this isn't a tension headache anymore. Okay? So another one not to delay, although very, very rare. Again, if there are neurological symptoms and very stiff neck looking down, it's best to get diagnosis early and rule it out. Rule out bacterial meningitis, as it can be fatal within days. I mean, it can be fatal within 24 to 48 hours, if it rages through too fast. Viral, typically much more mild. You don't really have to worry about that. I think I had that, like 6 months ago. I was knocked out, I thought it was just a migraine 2 days, 3 days in. Thought I got better, went back to work, had to go home again because crashed all over. I mean, this cycle repeated like 3 times, and pretty sure that's what it was. So much less aggressive and very unlikely to be to die from viral. But bacterial, you can't mess around, because that literally means you have a bacterial infection inside the meninges of the brain. Okay, that is rapidly expanding because there's no there's a separation of the blood flow here from the rest of the body. So the immune system has a harder time creating and mounting a response, because this is supposed to be a closed system. Okay, it's not supposed to have direct interaction with the rest of the bloodstream. Okay, next one, a space-occupying mass. Typically much more progressive onset of increasing and constant pressure, but not always. Okay, it doesn't always have to be. It can be fast. But most cases it's going to be slow as the mass develops, right? So usually we'll find other blood markers, because whatever is causing that to increase is going to show up somewhere in the blood, but again, not always. Once again, telltale difference is neurological symptoms like slurred speech, etc., as the brain continues to get more and more compressed from this growing mass inside of it. Okay? So this is more likely to be an odd progressive development of symptoms, instead of just like, I'm fine today and then I have a headache tomorrow. This is gradually gets worse and worse and worse and worse. We had a doctor, know a doctor that actually had developed brain cancer that was wrapping around his brainstem, and this is the way it went down. He just gradually got worse and worse and worse and worse, and then all of a sudden one day he was adjusting a patient and literally collapsed on top of him. So that is very, very different from your typical headache pattern. So better to take them seriously to increase chances of having options in your care rather than waiting too late. Not necessarily that you're going to do one particular thing or another. You're going to have open brain surgery, but at least you have options on the table of what to do, right? Okay, so that's it for the categories that we're going to cover. The big point that you see with all this is to pay attention to the variables. You know, this is what differential diagnosis is all about. It's understanding the variables that are there and knowing the split different signs, knowing when this is no longer a typical pattern and when this has become something new. And typically those are the factors that are changing the way that your brain or your personality operates. That's time to start paying really close attention. But any of the other typical cases, which we're talking 99% of headaches, are within the realm of needing to fix neurological coordination in the body. That's a chiropractic problem, so at least start there. Get your friends and family to start with chiropractic. And if that doesn't work, then we can start to look at other options. But you really can't, there's no more sane place to start, and no better place to start with minimal side effects than to start there, because when it's all said and done, I've done over 130,000 adjustments in my career without one single person filing a claim or suing or anything else like that, or any injury that I know of. 130,000, and that's the average chiropractor. Will do that same thing over the course of their career. And so we've got to pay attention to that and say, well, how many other medical practitioners do you know, or healthcare practitioners do you know that can vouch that kind of record of safety? So start with the easy stuff, start with the safe stuff, and then work your way to the more, as we would say, invasive therapies from there. Make sense? Okay, well, you all have a good night. If you have any questions, you can hang out afterwards and ask away.